Hey there, my name is Dr. Casey Greene, PharmD and certified functional medicine practitioner. Today we'll be covering L-carnitine as primarily how it's used in an outpatient medical setting. So today we'll cover what exactly is L-carnitine, what are the various clinical support uses and benefits that you can use on patients in clinic, what are the different administration options all the way from oral dosing to various injectable forms and the advantages and benefits of one versus the other, typical testing and monitoring that you might look at with L-carnitine, side effects, precautions, contraindications, all those sorts of things to watch out for to be on the safe side, and then popular clinic protocols that we most see used on a more the outpatient side, um, say like weight loss medical clinics and different things like that, versus not so much the acute care side, but we'll cover that a little bit as well. So, what exactly is L-carnitine? So, it's an amine that primarily plays a very critical role in energy production by moving fatty acids into the mitochondria, so the powerhouse of the cell. So, basically, L-carnitine is critical not only in burning fats, but actually turning them into usable energy. So, that's something that pretty much almost everybody wants. We want to burn more fat and we want to have more energy. So, it plays an absolutely critical role in that process. And that's the primary thing that we'll think of, but we'll cover a lot of other potential uses of L-carnitine as well. Also, importantly, it acts as an antioxidant. So when we create usable energy into ATP, it actually creates kind of a mess in its path. So it's important that L-carnitine is also an antioxidant and cleans up that whole energy creation process. Like if you think of a combustion engine in a train, how messy and much of a pollutant that is, that's similar to the process, the byproducts that are created when we make energy in the body. So luckily, L-carnitine also plays cleanup after itself uh, after utilizing those fats to create energy. It's important to note that only the L isomer is biologically active and naturally occurring, whereas the D isomer we would never use in a clinical or medical practice. 98% is stored in the skeletal and cardiac muscle where it's used to generate energy and power the body. And it is made in the liver, but the primary dietary sources are almost entirely animal foods. So it's more likely deficient in vegetarians, vegans, and similar dietary lifestyles, such as that. It could also be poorly absorbed in issues like leaky gut and things like that. So, how does it work? Part one. So, starting lipolysis. Here's where lipolysis of triglycerides or fats in a fat cell actually begins due to a cascade of hormonal reactions, epinephrine, and some other things. We won't go deep into that, but here's the starting phase of it, just to give you a basic idea. Then in part two, we've got transport and uptake. So this is where we've got fatty triglycerides being transported in the blood and the formation of acyl-CoA. The mitochondria is again where usable energy will be generated. So we're trying to basically move on towards the mitochondria so we can actually literally burn fat and create energy. Then in step three, this is where carnitine comes into play and is absolutely essential. So carnitine synergizes with acyl-CoA to get the fatty acid inside the cell's mitochondria or energy powerhouse so that we can actually begin that true fat burning and energy generation process. Then finally, in step four, beta oxidation of the fatty acid begins thanks to carnitine. So here's where ATP or usable energy will finally be generated using the fatty acid. So this is literal fat burning and energy generation in action in this phase here. So which form to use? We get this question all the time. There's the two isomers, L-carnitine and D-carnitine. So we've already covered L-carnitine as the biologically active and naturally occurring. We would never use D-carnitine because it'll actually compete and interfere with the effects of L-carnitine. They've tested even mixtures before, and L-carnitine by itself is far more useful, and D-carnitine actually gets in the way of the good benefits that we want from L-carnitine. There's also propionyl L-carnitine. This has been used in some studies and is currently being studied. It's not in nearly as many studies or nearly as well known or utilized as basic L-carnitine. Then we've got acetyl L-carnitine. This actually functions a little differently as a cholinergic neurotransmitter, and is more associated with use in cognitive disorders specifically versus the cardiometabolic and energy types of disorders that we'll be looking at with primary L-carnitine. And again, for purposes of this presentation, we'll be focusing mainly on the standard L-carnitine for fat burning, energy support, and cardiovascular support. So various clinical support uses and benefits. So like I said, fat oxidation and fat burning, which also by the same mechanism gets into energy support. That's the primary use that we typically see L-carnitine involved in. But it does have many other important uses as well. It's actually been studied in anti-aging pretty heavily. So with declining mitochondrial function, that's a big part of the aging process. And since carnitine tissue storage declines over time, the integrity of mitochondrial membranes can become compromised. So this gives carnitine big potential in supporting the anti-aging process. And there's many studies currently looking at that and showing very promising results. Then many studies have also looked at various cardiometabolic support factors involving carnitine. So for example, weakened heart muscles and various levels of heart failure have been shown to have low carnitine levels. So it's thought that supplementing could possibly counteract this effect to support heart failure patients. Additionally, carnitine has high potential to support improved blood flow in peripheral artery disease. And a large meta-analysis in 2013 actually looked at 12 related trials and concluded that carnitine can significantly improve outcomes for these patients related to heart attack, ventricular arrhythmias, and chest pain. So a lot of promise there related to the entire cardiovascular and type 2 diabetes and insulin resistance picture as far as carnitine use. So here you can see from Dr. Alan Gaby's nutritional medicine textbook, a lot of conditions that might benefit from support with L-carnitine, all kinds of cardiovascular from angina to atherosclerosis and heart failure, like we mentioned, to improving triglyceride profile and blood flow, and then various other conditions. It's got a lot of studies that show it does have strong support in immune function as well, from asthma and different conditions. And then there's a whole other list of conditions that has been studied in as well that we're not going to cover as in depth here, but just know that it can potentially have a lot of uses. And there are a lot of different clinical studies done in the past and ongoing for potential promise with L-carnitine therapy. So different administration options. Obviously, there's oral, and there are a lot of oral supplements out there. Unfortunately, those have very poor absorption rate of only about 20%. And what we'll cover in the side effects section, most of the side effects come from oral use versus the injectables, which rarely have any of the side effects as long as they're mixed properly and administered properly, et cetera. So for these reasons, the injection route can certainly have advantages over the oral route. And we'll cover those different potential protocols for the different routes here briefly. So testing and monitoring. Low blood plasma concentration, free or total, is typically what would be looked at, or SO-carnitine to free carnitine ratio elevation. Those are the ways that you could test for carnitine deficiency, but it's typically not done in the outpatient setting, more often in like an acute care setting where a carnitine deficiency might be related, like in the hospital setting, because blood levels can be in range per the lab ranges, but despite low body stores, because again, 98% is going to be stored in the muscle, skeletal muscle and cardiac muscle tissues. So it can be difficult to get a really good assessment just from blood plasma levels. But common deficiency symptoms we might see are, of course, fatigue, as we discussed with the basic mechanism and the primary thing where it generates ATP for energy use and fat burning. Also weakness, myalgia, or impaired cognitive function. So those are the primary signs you would look out for in carnitine deficiency. Now, side effects and precautions, primarily GI symptoms are what we'll see, but again, this is avoided with injectable therapy, so nausea, diarrhea, related symptoms, and then unpleasant body odor with very high doses, but again, typically when given orally, because this is from a reaction that's thought to occur in the GI tract during absorption in the small intestine. So if given orally, you can often counter this with riboflavin to prevent as much of that biochemical reaction occurring that creates the body odor. But the easiest way is just avoid by using injectable therapy instead. So it's pregnancy category B, which means animal studies show no harm, but studies have not been done directly in humans. So generally, we recommend only using if the benefits clearly outweigh any potential risks, even though it is a natural substance created in the body. And then with breastfeeding, it's a normal component of human milk, so it should be no issue there. Notably, in seizure disorders, L-carnitine has been shown to potentially increase risk there, so we recommend avoiding it in seizure disorders. Then just caution in renal and liver disease in general, just because it's not thoroughly studied there. It is renally excreted, but there's nothing that indicates that it would really be an issue. It's just not heavily studied, so something to just have caution there. And then with warfarin therapy, there are reports of increased INR and potential increased bleeding risk. So definitely something to note, that it might not be the best option for therapy if they're on warfarin therapy as a blood thinner, but could be something that could be monitored and then dosing adjusted from there. It just depends on working with their anticoagulation doctor. So popular clinic protocols. So with acute carnitine deficiency treatment, per the Mayo Clinic, 50 milligrams per kilogram per day for any given number of days, and then adjusted as needed based on results and labs would be, again, more the acute care type of scenario, but not as much what we'll likely be doing in most outpatient settings or involving energy or weight loss and those types of settings. So there, with outpatient nutritional supplementation, the most common protocols are either intramuscular or deep sub-Q, 100 to 500 milligrams, either daily to begin when you're really trying to supplement and get some strong results. But then it can be useful even on a just once monthly injection as a maintenance basis. So it's been studied all the way from there. So commonly what I'll see clinics doing is anywhere from 1 to 3 times a week to start, maybe even in combination with other energy support or nutritional support regimens. And then it might just back off to weekly or biweekly or even monthly would probably be the minimum maintenance dose. And then with IV, typically we see between 100 to 1,000 milligrams, with up to 1,000 milligrams daily for brief periods, or even 3,000 milligrams in severe chronic fatigue. Notably, once you get up to those kind of doses, there is risk of excitability and nervousness. So just be on the lookout for that. And basically the way to counter that is just to lower the dose back down. It just means the patient's sensitive to it and they probably don't need a dose that high. And when getting into doses that high, for example, ours is concentrated at 100 milligrams per ml. So it's preserved with benzyl alcohol. So you'd have to keep in mind the preservative there with higher dosing. So you wouldn't be able to just infinitely keep ramping up the dosing IV, just potentially based on the preservative and the neurological effects that could have. So just another thing to consider. But then there's also many various cardiometabolic combinations and protocols you could use for energy support, from B vitamin combinations, Myers cocktails and things like that. L-carnitine is compatible with a lot of different items and usually doesn't have a lot of precipitation issues with different IV mixtures. So it can usually be utilized in a wide array of different types of protocols. So here are some nutrients that are synergistic with L-carnitine. So vitamin C is actually required for carnitine biosynthesis. So it doesn't necessarily support carnitine in an infusion directly, but it will help the body with its own carnitine biosynthesis. So it is a good backup just to keep levels up and keep that support there. Then some of these other agents are also good, of course, in the energy and fat burning process. So methionine, L-carnitine is actually methionine sparing. So a lot of these just partner very well in the whole weight loss, fat burning, and energy generation process. And then choline is synergistic support against coronary atherosclerosis, and there's some promising studies and things looking at that. And then riboflavin assists with lipid storage and transport, so it works in unison with L-carnitine in doing that. Then some of the most common drug interactions with L-carnitine, and notably, these aren't bad drug interactions. They're actually good drug interactions. So notably, L-carnitine actually helps reverse carnitine depletion that can be triggered by some of these drugs. And especially like in chemotherapy dosing, for instance, L-carnitine can actually become highly deplenished and contribute potentially to chronic fatigue going on with chemotherapy. So carnitine can be good for energy support during that process. Statins as well, very common drug. Millions and millions of Americans on statins for cholesterol, and that can have negative effects on carnitine. So carnitine supplementation can be beneficial there. Isotretinoin, one of the most powerful treatments for acne, can have a lot of detrimental side effects, including carnitine depletion. So it can be good for support there. And then other antibiotics like gentamicin, things like that, can also be useful to support with carnitine during those treatments. So L-carnitine, in summary, there are many cardiometabolic support possibilities there because it's just so critical in the actual literal fat burning process, and the way that that's used to generate energy. But there are many other clinical support areas as well. It's got strong support as an antioxidant and immune boosting functions, can potentially support cardiovascular conditions, many different conditions from blood flow to uh, heart failure related conditions, and support many areas there. So, and it's got an overall great safety profile. Again, most of the side effects come from oral treatments and what happens in the GI tract. So most of those are avoided anyways through injectable routes. At that point, it just becomes a matter of making sure the osmolarity and basic safety things are in check, or that you're not injecting too much in one site, whether it's sub-Q or intramuscular, for example. So that concludes my presentation today on L-carnitine. So just really covering some basics and some ways you can clinically support your patients with it for primarily fat burning and energy support, as well as a few other conditions. So the contact information here is here if you want to reach out to us, and just please let us know if you have any more questions, and we'd be glad to help you out.